thinking about the use of industrial IoT and digital, probably no better use case than trying to recover from a pandemic. And as really this started for us, like many folks, went back in March when all of our customers decided to close shop and stay home, and what do we do? And what are our customers, what are they going to need when they get back to work? And will anyone care about digital transformation and smart factory, or just what's their focus going to be at? And so the team from LHP put our heads together and really start thinking about what's going to be needed when companies restart. Looking around what's happening, across the country, different countries around the world, and really we came down to they're going to need help monitoring, tracking, and really ensuring employee health and safety like never before. And how do we help? And really we help by applying tools we already have, tools we use every day, but in a slightly different way, but also focusing on solving the problem quickly, efficiently, and then thinking even longer term. Okay, if day one they get back to the shop, what's day two look like? And how can we help them on day two through getting going? And that's where it really made sense to not just come up with a point solution, but really help them leverage industrial IoT, leverage connectivity and digital transformation to retool the factory, to live off of working inventory, and really get back to innovating and get back to work. So that's really the kind of where we started, and so. There we go. Tim, you got to make me. There we go. Are you going to make me the presenter? Do I need to do anything?
You should just need to share your screen.
Okay. So we've been having a good time all all day with the. Yeah.
Here, I'll stop my share.
Okay. There we go. There we go. Okay, I think we got it now. You guys see that okay, Tim?
I see a very large Firefox symbol and microphone.
Okay. Well, we'll try it again. How about that?
There you go. Now we.
Okay, great. So it has been one of those Wednesdays. Okay. So again, we've kind of put our heads together and developed this connected workplace health, which is really leveraging IoT and connectivity, not just again as a mitigation, but as a platform for innovation. So kind of run through just brief introduction of who LHP is. We're one of those companies that are not a lot of folks have heard about yet, but we are in some of the heavier spaces of engineering. We're an engineering technology and solutions company focusing on autonomous and electrification, connectivity and safety, and working together, we build a safer, smarter, more connected world. Probably no better way to describe post-pandemic operations. Large customer portfolio, big companies, small companies, fast companies, slow companies, but also a pretty healthy medical vertical that we've been in. And this definitely helped our ability to move quickly as we develop this solution. We'll talk about that a little bit later. Lots of different end markets, automotive, industrial, healthcare, raw materials. I think I spent a little bit too much time out in the smelting plant up in Detroit a few months ago. Oh, James says I'm not in the presenter view. Is that right? Is this presenter view for you?
This is actually looking at your base. It's not looking at the presentation mode. It's looking at the just inside PowerPoint.
Oh, okay. All right, let me fix that. Hold on.
I like the dark theme though.
It's cool. Is that better?
We're still seeing the same screen. I think it's okay.
Okay.
We're seeing the 7 pillars of LHP digital strategy.
There you go. We'll run with it. How about that?
Yep.
So again, so when we look at digital, we kind of divide it up into the 7 pillars, like building a house. Everything from product, customer, smart factory. Do a lot of work in there. It's connected engineering, and then really we think about the connected workplace health. It's combining these 2 bottom pillars: the connected employee and the connected workplace. And focusing on employee health and wellness, but also looking at overall building and workplace health. Break those down into different value levers. But oftentimes you think about digital transformation as a very aspirational kind of endeavor. This COVID-19 has really brought it down to the more fundamental basics of employee health and safety. And so you see down here at the bottom, the connected employee. That's really the kind of the basics of manufacturing. And then leveraging IoT, right? You can apply this to more and more. So we think about the connected workplace health analytics. And again, like I was talking about earlier, most companies that we know and folks are learning every day are really unprepared or just don't have the tools for the amount of monitoring, tracing, tracking of employee health in this post-pandemic workplace. You just think about the number of interactions in the course of a normal factory. I'm getting, oh, there we go. How's that? We'll just run it this way. There we go. No, wrong one. Okay. That's better. One of these days. Better. There you go. Okay. So I'm getting real-time feedback here. So again, you think about the last 30 years of manufacturing. It's all been about working together, big teams. But this is a major change. And adding to that challenge is a lot of companies are coming back with really a lot of unknowns in terms of the backlog, the economy. We're all seeing customers push out, big capital spend. Really, it's just a real challenge. And so, whatever we develop as a solution can't be a good idea. It can't be an R&D project. It can't be vaporware, but it's got to be something that companies can use right here, right now, production ready, that they can get back to work. And so to meet that need, we combined our large-scale healthcare analytics that we've been using for a couple years here in the Midwest with our ThingWorx IoT platform to create the connected workplace. And because we're leveraging proven solutions, companies can then quickly and cost-effectively leverage digital transformation. And not just to get in the door, but to thrive in this critical period. I mean, companies are still competing. customers are looking for products. And even though everyone's in recovery mode, you got to compete on cost and efficiency and scale and capabilities. And so, again, back to the value proposition is, yes, this is a COVID mitigation, but again, it's a platform for innovation. These tools, this IoT framework, the analytics can be used for working capital, machine utilization, other safety initiatives. So if you're going to spend money in this time frame, make sure you're getting a good value prop. Thinking about the challenges in the post-pandemic workplace, many of us are still sitting at home. But again, as companies come back to work, it's a whole new ballgame. New hygiene protocols, expanded PPE. Trying to put in social distancing in the workplace. Again, you think about it. How many two-person lifts are required for toolboxes? I mean, just the basics. Companies are having to deal with. And again, the traceability of potential exposure. So many different challenges. And a lot of companies have told us that even if they solve COVID-19 tomorrow, the potential for recurring exposures may last for years. And then even further, the risk of new exposures is something that they really can't afford to have again. It's one thing to be shut down for 3 months. You can never do that twice. And so we really step back and say, okay, what's the problem we're trying to solve? And we're not just here making blinky lights and pretty charts. Number one is to make sure it's a safe workplace for the employees. And if we can't do that, if our customers can't provide that, then we really haven't helped anyone. And so that's our number one priority. And by doing that, it allows these companies to reopen, which allows the economy to get back started and healthy. But also, we're trying to help minimize the risk of future exposures by giving our customers the tools they need, the information they need to manage risks, to manage exposures, to manage their facilities at scale. And we do that by providing a technology foundation for future innovation. And again, on this same solution, leveraging ThingWorx from a platform, these sensors and gateways, you can have the same sensors on an employee badge or on a piece of equipment. You can tie that into your equipment from a utilization, building management systems. Just so many other use cases can be built on this foundation. Okay. And then what's the risk of not having contact tracing capability? We've seen in the news lately, companies try to start and then they have an exposure, they have to send people out. Just loss of revenue. This is not the time to lose revenue, but if you're not managing this, that's definitely a big risk. Continued disruption of business operations, and then the legal ramifications of dealing with employees being infected. And finally, back to running a healthy business is just having reliable and timely data to gauge risk, to manage the business. Not a lot of companies like flying blind, and I think in this time frame, people really feel like they are struggling with the amount of challenges coming at them. Okay. So let me kind of walk through the basics of the system, and then James Roberts, our technical leader, will take you through the demo. It's a pretty light system. It looks a lot like any other architecture from an IoT standpoint. You have your data inputs, your biometrics from your temperature and those kinds of things. Health questionnaires, I think we're all getting used to filling those out. Capturing those leading indicators, developed by medical staff, the health and safety teams, legal, HR, integrated into the solution, and then the workplace IoT sensors. So location, proximity tracking, some good low-cost plug-and-play solutions. So those are brought into our digital facility maps, integrated with our healthcare analytics platform, and combined, that gives us the ability to provide alerts, analytics, monitoring, traceability in a pretty lean and light application that's also flexible and scalable. And again, for customers that already have ThingWorx, this is a real easy, just drop in, plug and play. For customers that are looking at an IoT platform or maybe haven't had a really good use case to warrant that initial investment, this is a pretty good business case. We ran the financials, and for even a mid-size facility, the cost of less than 1 day's shutdown would pay for this system on the hardware, the whole thing, and more. So it's a pretty easy business case to get past the chief financial officer. Few more examples of the solution before I turn it over to James. So again, really light. It's a proximity badge. Could be BLE, could be LoRa, could be a number of others. That's all being fed. So we can do heat maps. You can do zone references, pretty light and easy. You can either integrate it into a single badge with your door badge or as a separate, attachment to your lanyard, but pretty light. The health questionnaires, can be as simple as a one-page form. Some companies have, we've seen up to 6 or 7-page health entry forms, depending on the facilities they have. All those can be integrated. And again, can be manual. Some folks are using, those infrared guns or whatever, health, heat screens. All that can be captured into ThingWorx, and then you can lay out your facility. This is a good example of setting up various zones. So you can do the proximity person to person, or look at a zone. So think about like your cafeteria, your some of your work areas. And again, in the factory, there's areas and jobs where you're going to be in close proximity, even with the 6-foot rule. And so you can set a zone around that and just limit, how many people should be in a zone, to keep overcrowding or to minimize unintentional gathering. And so again, just manage by exception. See the green, yellow, red, point and click. With the zoning capability, you can do a lot of different flexible capabilities based on how the business is set up. So in this example, zone A might be your front lobby or where your customers might come in. You may manage that differently. Zone B might be your factory area. Zone C might be your administrative areas. Zone D might be your lab and loading docks. So again, you can customize the setup, do your geofencing and alarms, and really leverage IoT to help run your business, but also help manage, the movement of folks, but also give you the alerts you need to manage post-pandemic. And then again, the ability to do custom analytics, get the alerts, the drill down, drill through, proximity and traceability, whether it's looking at, from the employee, okay, where are they working at and who else might be exposed, or, we had an issue in the chassis line, who are the folks that are in there that may need to be sent for testing, that type stuff. Your dots on the map. And again, lots of different ways to set this up to manage that scale. And then, most companies have multiple sites. So as a leadership team, as an HR team, you can be looking across the region. We got a hotspot over here in Redford, right? Click in, click in, click in. Again, giving our customers the tools they need to not just manage, but to be more proactive and be more interactive in managing post-pandemic. So covered quite a bit. Again, a lot of material. And again, we're trying to really emphasize, these tools, these solutions can be applied, yes, to the COVID, but really immediately integrated with your material tracking, with your machine utilization. It can be applied for other health and safety initiatives, confined space management, and those sorts of things. So meant to be scalable and flexible. All righty. So with that, James, I'll turn it over to you.
Okay. I think Tim will just, okay, here we go. And Tim, I don't know if it's possible, but I think me, I like to do live Q&A if possible as well. So maybe once I go through this, if we can unmute everybody, that would be something I would appreciate.
All right.
All right, and so hopefully my screen is showing.
Yeah, your screen's showing, so nice
All right,
job.
Cool. Yeah, so let me try to level set everybody from the technology perspective. So the one thing you can't see from a WebEx is the hardware that's being used. So think of employer badges, they're the size of a credit card. And these lanyards, badges, trackers, beacons, whatever nomenclature you want to put on there, this is what's doing both the personal proximity tracking and the zone tracing. So just to clarify the difference, the personal proximity tracking, that's where we can set the thresholds between 4 to 8 feet, 2 to 4 meters, whatnot, to see, have Mike and I or Tim and I been in close proximity with each other. These badges can beep, buzz, vibrate if there's a certain threshold that's been overcome. So you can set that at 30 seconds, 90 seconds, whatever, all customizable, both the transmission power and the thresholds. And then on the second side, these badges in conjunction with a gate and area badge, they can do the zone tracing. So in this concept, this is where you're putting a tracker in like a lobby, a cafeteria, north side of the cafeteria, south side of the cafeteria, paint booth, performance lab, cell A, cell B, etc. And what that allows is there are 8 people in the cafeteria, and so there's some different algorithms that go on there and different use cases, but the same technology, same hardware, all feeding through APIs to our very thin system, and I'm showing you it through PTC ThingWorx today. And so as soon as I'm done kind of going through this, we'll open it up for some live Q&A and we can answer any more specifics. So the idea here, this is a front loading page for a customer. This would be completely customized based on the needs of that individual customer. We're looking at, from the top down, how many screening events took place as they entered the facility, how many unique employees have been screened, and then we can look at information like how many trackers have assigned and how many trackers have data versus trackers without data. So there's lots of back-end things from a process perspective. In this instance, we would see that 9 trackers are not transmitting data. It could be that they're not transmitting. It could be that the person's not wearing them. The person's left them at home. There's lots of use case or lots of cases that can apply here. and just a simple chart of how many screens have been conducted per day and then how many tracing events have been conducted per day. And then in the test, trace, isolate paradigm that probably everybody's getting really sick and tired of hearing about right now. But we're not medical professionals. Companies aren't, that we're talking to normally aren't medical professionals. So we're not doing the actual physical tests. But in a testing traceability and employee health traceability, what we're providing are some very simple forms to get the employees back through so that we can trace them throughout the day or throughout the coming time periods. So in this, in this area, Tim shows up today at work. He has a 99.8 degree temperature. He is wearing a face mask, but he complained about having a recent cough. And then HR or whoever is facilitating this process, it could also be self-administered. They can put in some notes and we can submit the screening data. And then this will allow us to have that traceability so that if Tim, his temperature starts elevating throughout the day or throughout the week, he's starting to have some other symptoms, this information it can be tracked to look at. One note I wanted to point out here, at least around the United States, is about HIPAA. This is symptom tracking. It is not diagnosis tracking. And so this does not fall under the HIPAA purview. And we've had a couple of lawyers help us with articles, and our healthcare partners have provided a lot of the help to say, this is not HIPAA. Employers have every right to take this information because they're tracking symptoms and the health of their workforce. So this is kind of replicating the test. Then we have a bunch of management screens. So what's going on here is, regardless if you're doing the personal proximity tracing or the zone tracing, what you're going to need to do is associate an employee with the tracker or the badge. So these trackers all have a unique identifier. Think of it like a MAC address or a GUID. It's just a long string. This is a one-time setup where we would, assign Tim his tracker. It's also a type 2 dimension, so it has start and end dates. And if Tim loses his tracker, his battery needs replaced, or he has to swap out trackers, as soon as you enter a new pairing, it will end date the old tracker and start a new start date with a new one. So that all just kind of flows behind the scenes. So this is done one time, an initial setup, and then on an as-needed basis for new employees, maybe visitors in a lobby, if you want to assign it to the visitors, or again, like I said, if a tracker was misplaced. If you're doing zone tracking, the next step is to add your facility. So maybe we're doing zone tracking at Tim's house. We'll choose a file. We'll upload the image to ThingWorks. It'll show you a preview of the image, and then we give the height and width in pixels, and we submit the facility setup. And what this will allow us to do is show the dots on a map, the heat maps, and the thresholds. The second step is then associating those zones. So if we were setting up a zone in a performance lab, a conference room, a kitchen, or a bullpen, you set the beacon identifier as the zone name. You give it a nice user-friendly name, and then you give some equivalent north and east latitude longitudes for the image map and the width of the zone. The most important kind of feature and setup that we've had for our customers is this density threshold. So this is allowing like a heat map or an occupancy alert. So if our performance lab, we only want one person in the lab at a time. Anytime 2 people or more are in the lab, based on this threshold, we can throw alerts, we can send emails, we can color code the map red. Lots of functionality we can do to say that threshold has been over occupancy. Another thing, if facilities needs to clean a room or disinfect it, you can instantly set the threshold down to 0. And that way, if anybody comes in, you're instantly alerted if they showed up before facilities was done disinfecting. When all that comes together, you have I'm just going to switch over here real quick. You'll have your map, and you'll have it color-coded on the zones. So in this case, our performance lab had a threshold of 1, but you can see 2 individuals were present, and the map is turned red. It'll send an alert, etc. So then when it gets to tracing, all the data is sitting in a SQL server in the back end, and now we can do some potential exposure analysis. So let's say we have an individual. This is always our guinea pig, Brian. And on April 30th, he was diagnosed with COVID-19. We can also add in a backtrace days. So this is what the CDC says. He may have been contagious 5 days prior to diagnosis. So we can set a backtrace, or we can set this date to April 25th. And we can run an exposure analysis. And now based on all of those events, from the personal tracking and the zone tracking, as we go down the sheet in detail, we can see who he was exposed to and how many times. We can see on what date those exposures occurred and how long. And then we can see the actual location. We can set thresholds where maybe we won't ignore exposures that were under 60 seconds. Maybe that was just passing by an area. So there's lots of thresholds we can set to really hone in on the data. Some of our customers have asked for, if 2 people share a room and we know they share close working proximity, can we just have an exception where there's no alerts or no, the badges aren't going to beep all the time for them? And the answer is yes. We can very easily set some exception processes. You can also export this data to CSV in case you need to share with a local regulatory entity or anything else. One of the other things we can do, going back to Brian, is we can look at a full contact tracing tree. So now I'm selecting full tree on the menu, and now when I run the exposure analysis, I can see a full contact tree. So if in this case, how we interpret this is if Brian had let his HR know that he was diagnosed as positive, they could now see that James and Paul had been in contact with Brian. We can look at the exposure, and we can email, contact, whatever the process is, James and Paul, and say, hey, you 2 have been exposed to an individual in our company that tested positive with COVID-19. We may not take further steps. We may isolate these employees for a couple of days just to ensure they're not showing symptoms. We may isolate them along with Brian, but whatever that process is, that awareness is provided. In addition, if we're very confident that we need to isolate Paul because we have some likelihood to think that he may be susceptible, we can also see the contacts that he had in with employee number 1. So we can build that full tree dynamically. Other features, we can see location history. So again, with Brian, put in a start date. We can see every location he was in. We can see all of the COVID response data. Here's the data I put in for Tim earlier. We can see everybody who has potential low batteries in their devices, and we can send email alerts to them. Please replace your battery. Just a very lightweight front end for managing some things that we don't want to have to do manually. We can look at the potential issues, trackers assigned with no data. Here was Tim's tracker I just entered. Obviously, there's no data in this demo. So that's a use case. And then finally, on the test, trace, and isolate, if we do have to isolate an employee, we can have an entry form for HR where they can put that employee's information. And now we can just kind of track what employees have been isolated, when are they coming out of isolation. In the back-end system, if this employee has showed back up to work before their isolation was over, again, another alert to the proper person. Final thing I want to mention on this is This is intended for a smaller audience. Not every employee at a company will have access to this. This is just for your HR, HSE, facilities leaders, that core team that's really managing, the pandemic response. So, if I were a simple, just an employee, I would probably not have the appropriate role-based authentication to have access to this site and do anything here. So at a high level, that's the system, very thin database, API management, and application from ThingWorx. So Tim, that's what I've got on the screen sharing. So unless you and Mike have something else, I'd be glad to open it up for some Q&A.
All right. I'm going through the list and allowing people to talk. So if you want to ask a question, you'll just need to unmute yourself, and then you should be able to ask the question. I had a couple of things come to me during the presentation. One was if you have different requirements by state and region across different facilities, is there a way that that can be handled?
So yes, the answer is yes. It's obviously not in the demo, but since everything is organized appropriately in the back end, if on our facility or we associate it with a different state and we had different alerts, triggers, or requirements, we can build that in.
Another question that had come to me was around implementation time. So if you already have ThingWorx, how long does this take to get set up?
Yeah, so right now we're quoting, obviously depending on the size of the customer. If you already have ThingWorx, this is literally probably a day or two install of the application. Then just making sure we get your security requirements understood. And then from a rollout perspective, the hardware is probably the one-time consumption that just needs, we can help your company set up that process, do a bulk upload, bulk provisioning of the badges and tags. And so in that case, if ThingWorx is already installed, we would probably be ready to roll out in a week. And then we also quote about another week if we need to actually install ThingWorx.
Let's see, I'll also note that if you prefer, you can enter your question into the Q&A or into the chat.
Yeah, and there's been a couple of questions on the presentation. I think Mike and Tim will ensure that that presentation is shared appropriately. Yeah, and I think if you have questions that you may not want to ask or that you come up with later, feel free to reach out to Tim, and we can help coordinate a response to get those questions answered. Okay, I see one question. Question is, how does a solution include or work with the hardware implementation for the beacons or badges? So the badges that we have a couple hardware solutions that we're working with. One company from Rhino Defense, they've got what's called a back to work badge. It looks just like the size of a credit card. It is a peer-to-peer BLE, Bluetooth Low Energy badge. So it's what's doing the proximity tracking and the zone tracking. And it connects to the Wi-Fi on the customer site and will upload the data periodically at a set interval. And that data is uploaded through an API that is rendered through ThingWorx. And so that's what's taking the data from the badges and loading it up to the back-end implementation. In addition to BLE, we have a hardware partner that does LoRa technology. So if you don't want to use BLE and you want to use LoRa, and you don't want to use Wi-Fi and you want to use the LoRaWAN, that's an option, because some customers are sensitive of of Bluetooth within big, heavy metal machinery in factories. So LoRa is an opportunity. We also have a partner that's doing this with RFID tags. RFID is a little more expensive just because of the infrastructure that has to be set up from the scanning perspective. But those are kind of the three technologies that can be used both together or independently.
Hi, James. I'm new to this solution, and I would like to ask: is there somewhere I could go to, maybe a website where I can read more on this solution and understand, so I can address it to my organization or something?
Yeah, so I think Tim and Mike will point, when we send this out, will point us to the webpage with more information, and then the PowerPoint materials as well.
Okay, that's fine. Thank you.
Yep, and we're happy to get on a one-on-one call with you as well in order to walk through some of the details of the application.
Okay.
Let's see. I see a hand raised from Bob. Are you having issues getting off of mute so that you can ask a question? If so, please just go ahead and type your question into the Q&A or the chat. Or just speak up. One thing that I'll cover while people may be looking through things is for the poll results. For the first poll question, which was the plant status, 18% were completely shut down, 53% were partially reopened, and 29% were fully operational. So if we think about how this kind of a solution can apply, in all of those different situations, obviously if you're shut down, there's no immediate benefit, but that can be the easiest time to, implement a solution like this. If you're partially reopened, where you might have like demand, or you're partially reopened, you have full demand, but you're looking at doing the social distancing and changing your work rules and so forth, this solution is very applicable to assist with that process. And then if you're fully operational, being able to do that contact tracing for employees so that you can stay open is very critical. The second poll question was about demand status, and unfortunately, as expected, quite a few of you had demand that was very heavily impacted and is kind of slowly returning to normal. There were a few people that had demand that was lightly impacted and hasn't come back yet. And there was one lucky soul on the meeting that actually had demand increase. So I guess food and beverage or toilet paper. So with that, we did get another Q&A from Sean on the question of how this data relates to HIPAA. Is there a point where the data by volume, type, or other would then become HIPAA relevant?
Yeah, so I'm no expert on this, but from what the legal people that I've talked to and the healthcare people that are in insurance and well aware of this have told me, is that HIPAA is first and foremost is meant for providers of healthcare information and health companies. That's insurers, doctors' offices, those entities. So most of the customers that we're talking to don't even fall under this purview. The difference is the confusion kind of between HIPAA and ADA and all that. So kind of the point of HIPAA was so that you could not, do prejudice against an employee for a diagnosis that was previously diagnosed. In this case, these people are already employees of a company, and we are looking at symptoms, not diagnosis. And furthermore, when a pandemic has been declared in the United States, and even outside of that, employers have the right to track this information. So hopefully you don't take, James Roberts' word for all of that, but there is a lot of documentation being published on that right now. So I hope that helps, but as long as you keep it to tracking symptoms around COVID-19, HIPAA does not apply.
Yeah, James, I think also, there is a sensitivity around personal information. And, I know in the demo we use, James, Brian, Tim, but, in the actual implementations, those are going to be employee IDs. There won't be the employee's information on the badge. We're really doing badge management. And so then from a systems implementation, we're going to be following, that company's security protocols, personal information protocols, just like we would with any other application. And then finally, you talked about it earlier, this is not meant to be a reader board that's splashed on the side of the facility. This information is controlled, role-based security, access security, even within the application, some of those screens are restricted to certain individuals versus others. And so again, we're trying to be very cautious with who sees what and really taking the lead with working with the customer on the appropriate access. And then Tim, kind of playing off of your comment about, or the poll about some folks are still just recovering or just coming back. Actually, now is probably a good time to, and most companies already have their COVID response war room team sort of trying to figure out how to reopen, what questionnaires, those sorts of things. It's actually a good time to start some of these early discussions. Because most of the work on setting up this solution is all the upfront requirements from the customer. What's the health screening look like? What's the process as people come in the gate? We've built a lot of the tools to help that solution. So again, you imagine, I walk into work, I'm running a fever. Okay, then what? Do I go home? Do I go to a nurse's office? What do I do? There's a lot of those process type of questions that are out there that can be built or have already been built into the solution. And so as companies are refining, their day one operations or beyond, sort of laying that out, now is a good time. And then again, purpose of this innovation platform, okay, we're back in the shop, pipeline's a mess, we don't know what demand is. A lot of companies are going to be living off of inventory reductions and just really trying to get back to work in an economy that's a little dicey. And so there's so many ways to be using these tools, from ThingWorx, from these type of sensors, to lean the factory, work on optimization, so many more business cases that the companies will need to be tapping into to drive efficiencies, to get back to scale. And so keep that in mind as you're thinking about your recovery plans, is, how do we really get this thing moving again?
Yep. And a couple of the names that I recognized from the list here are in more office environments. Uh, can you speak to the applicability of the solution
Yeah.
in an office environment real quick?
Oh, definitely, definitely. We get a lot of customers, and again, most customers have a front office, customers coming in, contractors. And what's great about this solution and these badges is they can be handed out to visitors as they come in, get the traceability. And again, if they go home, we never see them again, but there's an exposure event, we could be notifying them, the customer could be notifying them saying, hey, while you were on premises, such and such happened. You can also minimize or monitor, where they move throughout the facility. So make sure that if you got a restricted area or you're limiting foot traffic through a certain spot, again, you can get those alerts real time for visitors coming through. And again, one of the challenges that companies have talked about with other applications is extending it to contractors, subcontractors, whoever else that maybe aren't an employee. And again, all of this can be extended so that you've got really full end-to-end coverage that you'll need for the traceability. And so we have some pretty sizable, just pure brick and mortar retail office building customers. And then most of our manufacturing customers have office buildings, have labs, have a multiple type of environment. We've even had a couple of customers who do temporary housing for remote employees, extending this into their housing areas. So very flexible.
One other question that I've seen come up, not in this circumstance, but from other conversations, is there are kind of a number of different efforts going on from Google and Apple and working with the government and so forth to do contact tracing. How does this differentiate from what's going on at the governmental level?
Yeah, I mean, there's lots of things out there. There's a whole, number of sites. The challenge of those Google, Apple apps and the phone apps and things is it's hard for a company to manage that, and it's hard to ensure that everyone has a common platform. When you start trying to tap into people's cell phones and things, that opens up a lot of challenges that is tough to really manage. And then for most manufacturers, even if people have cell phones, they're not allowed to use them on the shop floor. So some of those solutions are really not even viable. And so what we're trying to do is provide companies with a solution that they can manage the data, control the data, limit who's seeing, again, their employees' information, make sure everyone has a common platform, so you're not worrying about a mixed mash of cell phones and apps and whatnot. That seems, again, there's lots of good use cases for other ones. I'm not saying they're not, but it's hard for a company to really leverage those and manage those at scale. And so more and more are turning to this kind of a solution, as well as, this is just not a point solution. So this is a first of a digital roadmap of leveraging digital and IoT.
Right.
And so, the value proposition of those other solutions versus this, again, they're in a different category.
Yep. And, to kind of answer my own question a little bit, it is really the control of the data from what I've seen is the big differentiator there in terms of the solution itself. And when companies are, contacted by health authorities to say, one of your employees, turned up with a positive result, we need you to do contact tracing.
Mm-hmm. Yep.
It's been a very manual process for some of the companies that I've talked to be able to get all of that done, despite some of these governmental things out there.
Yep.
We had another question come in. Once the data on the form is recorded when the person started duty in the morning, if their temperature actually increases, during the day, will the sensor be able to sense that automatically? And
Yeah.
I'll take a first crack, and then I'll turn it over to you guys. I don't think that anything that we are doing will automatically sense that. That might be something where if you have a temperature gauge that you're using as employees walk in the building, maybe after lunch you screen them again with that same process. What this will do is to establish a baseline. People have a natural variation of temperature. So for instance, my temperature is actually usually around 97.1, 97.5. And so if I walk in with a 99 temperature, that actually should be flagged because I'm a couple of degrees above my kind of baseline temperature. Whereas other people have a baseline temperature that is 99.5. And so by actually putting this information into ThingWorks, what you can do is you can compare that individual employee's current temperature against what their baseline is to be able to see where they are relative to their normal, as opposed to the median temperature of 98.6 for kind of all humans. And so I'll turn that over to you guys to say if any of these sensors are able to automatically capture temperature or anything.
Yeah, no, you're right, Tim. So again, we're not doing the temperature tracking real time. Again, that's up to the company how often and the frequency and when. Because you're right, you know, working during the day, you're gonna warm up. So those processes the company will work through, and then they can update those in the system as needed, and then all that data will feed in. And so we're doing the proximity tracking and tracing, person to person, zoning, and not trying to get into the biometric side of it.
All right, we have kind of hit our hour. If there are additional questions, please reach out to me. My email address is tim@visualdecisions.com, and my phone number is 630-957-8096. If you have questions or would like some follow-up, please reach out to me. I will be following up with everybody that registered and reach out to you to prompt some of that follow-up as well. So thank you all for attending, and especially thanks to Mike and James for going through the solution with us today. And any final thoughts?
No, this has been a great session, and again, a lot of companies looking at how to manage this. So appreciate everyone joining today, and hopefully we helped, and happy to answer any questions or provide more information as needed.
All right. Thank you all. I will also be, again, following up with each of you individually to see if you have any other additional questions. Thank you very much. Bye-bye.
All right. Thanks, Tim.